Welcome to today's press briefing. We have with us Dr. Zhang Shukwan, Head of Communicable Disease Branch, Center for Health Protection, and Dr. Lau Ka-hin, Chief Manager, Quality and Standards of Hospital Authority. Dr. Zhang will give you an update. We recorded 60 confirmed cases as of last night, with case numbers ranging from 10224 to 10283. These cases include 30 males and 30 female between the age of 14 and 88. 13 of these cases are identified in temporary testing centers, 4 of them being identified within the Yau Ma Tei area. Of the 60 confirmed cases, we have 3 imported cases from Dubai,
57宗本地個案啦。
in Tongfat Building, Block C of Camping Street. This is a building subject to compulsory testing notice. The compulsory testing notice was earlier issued, and we later identified more cases. At the moment, 8 confirmed cases have been recorded, but we have 5 more cases that are preliminary positive. So together with the preliminary positives, we have 8 units involved and 13 persons affected. Our colleagues and Professor Yun are now at the building conducting an inspection to try to find out the cause of the numerous cases. We also have quite a number of buildings today subject to compulsory testing. The notice will be issued, including buildings with 2 units affected, as follows: Tip Yi House, Butterfly Estate, Tuen Mun; Chuan Wan Building in Ma Hang Chung Road, To Kwa Wan; Yi Man House, Ho Man Tin Estate; To Shu House, Le Muk Shu Estate; Linwood Court, Block 9, Kingswood Villas, and also Wah Hei House, Tong Hei Court. Now, these are buildings that we have identified at this moment, and the compulsory testing notices for these buildings will be issued later. There are also some buildings within the specified areas in Yau Ma Tei with one or more confirmed cases. They include Shannon Building in Tung On Street, Shanghai Mansion in Pitt Street, and 434 Shanghai Street. As for the Jordan restricted area, there is a specified area. We identified one more building, that is Manking Building, Manying Street. And earlier in Chai Wan, some residents were subject to compulsory testing, and the period is coming to an end soon, and we would recommend another round of testing to be done. There is a restaurant called Wingming Congee Shop in Hong Kong, and some cases have occurred involving the waiters and cooks in that restaurant. Some cases are still pending. So far, we have 6 confirmed cases and 1 preliminary positive case. Now, 6 confirmed cases are family members, and this could be a cluster, and there could be transmission in the Congee shop. Now, so far, we have no information of any confirmed case having visited the Congee shop. But if you have visited the Congee shop, and if there is suspicion, please get a test as soon as possible. In fact, after the first confirmed case service, we already asked for the restaurant to be closed and for everybody to be tested. In the congee shop, there are about 10 employees. All of them have been sent to quarantine centers. And among the confirmed cases, we also had a case involving a resident of a residential care home, and that is the Kinning Nursing Home. The resident was sent to Asia World Expo, and upon testing, we identified this case to be positive. We understand that there is another preliminary positive case. That concludes my report for today. Dr. Lau. Good afternoon. As of 9 a.m. today, over the past 24 hours, the HA recorded 65 confirmed cases. Over the past 24 hours, we have 3 more patients passing away in public hospitals, including 9542 mentioned yesterday, and another patient, a 67-year-old male patient in United Christian Hospital. Case number 7123 with underlying history on the 7th of December because of fever and upper abdominal pain. He was admitted to United Christian Hospital and he was confirmed. His condition continued to deteriorate and he passed away at 8:26 in the morning. Another case is a preliminary positive case, a 56-year-old female patient with chronic illnesses. Because of shortness of breath, she was escorted to A&E unit of Kwong Wah Hospital by ambulance in the morning, and there was a cardiac arrest upon arrival. So CPR was administered together with intubation. The patient later regained consciousness. She was sent to an ICU for further treatment. Yesterday afternoon, she was preliminarily diagnosed with COVID-19. Her condition continued to deteriorate, and she passed away at 4:22 in the afternoon yesterday. The infection control team of the hospital immediately started contact tracing and confirmed that the paramedics in touch with the patient had worn suitable PPEs and no staff had been identified as close contact. So far, 169 confirmed cases and 1 preliminary positive case have passed away in public hospitals. As of 9 a.m. this morning, over the past 24 hours, 61 patients have been discharged upon recovery. And so far, 6,162 patients have been discharged on recovery. As of 9 a.m. this morning, 856 patients are now receiving treatment in 25 public hospitals and Asia World Expo. 32 of them are in critical condition, 31 in serious condition, and 793 patients in stable condition. As for negative pressure beds, 1,220 beds are available with an occupancy rate of 70%. We have 672 negative pressure wards with an occupancy rate of 77%. I'd like to report 2 incidents as well. One in relation to the Chinese medical treatment that was commissioned yesterday. Starting from yesterday, COVID-19 patients in Asia World Expo could select Chinese medical services there. Through the tripartite research and treatment center, we would provide this service to COVID patients free of charge to give them another choice to help alleviate their symptoms. Participation is voluntary. Anyone above the age of 18 who are eligible persons in our system can participate. After clinical diagnosis provided by Western and Chinese medical practitioners, we have to confirm that the patient is suitable for such treatment. As for the special Chinese medicine service in China, in the Asia World Expo commissioned yesterday, the operation of smooth. As of noon yesterday, altogether 14 patients received this service.
Another follow-up on Queen Elizabeth Hospital. The infection control team there, and also together with Center for Health Protection, after their assessment and discussion, they decided later today they will reopen one of its previously closed medicine ward and to recover accepting new patients. After the coordination of HA and public appeal, people who went for emergency cases at Queen Elizabeth Hospital dropped in numbers, and the pressure on hospital services was eased. Queen Elizabeth Hospital from this morning has resumed normal operation, and in accordance with his usual mechanism, from noon onwards he has started receiving patients sent to the hospital by ambulance man of the Fire Services Department. The hospital likes to thank the help of other emergency clinics and other public hospitals and public understanding. And the hospital will also closely monitor the health of staff and patients in the ward, and also maintain communication with the Center for Health Protection. Staff at the Queen Elizabeth Hospital underwent voluntary testing yesterday, and the process of testing has been progressing smoothly. We've encouraged our colleagues who work at Queen Elizabeth Hospital to undergo testing. That's the end of my report. Now it's time for questioning. Please, before you ask a question, introduce the organization you're from. First person in the middle, please. Hong Kong 01. I'd like to ask you how many preliminary confirmed cases today, and also in the new list of building subjects to compulsory testing, how many cases were found in each building, and how are the units distributed? Are there any suspected vertical or horizontal transmission cases? And also in Tung Fat building, where 2 units, 3 people were infected on the same floor. Of the new cases today, are there patients on the same floor? Could you tell us which floor it was, and do you intend to evacuate residents in that building? And I also like to ask about yesterday's Pitt Street, the restricted area. The 93 units have not been contacted. How are you going to trace them down, and have you got a name list of the residents there? And also Shun Feng building, which was subject to compulsory testing early on, they have to be retested. Is it that buildings, residents in buildings which have been subject to compulsory testing, they have to be retested? So far we've got under 40 preliminary positive cases. Tung Fat building, early on there were 2 units on the same floor. Later on, 1 more unit on another floor was infected. And there were 2 more cases found today on 2 other floors. We've also got 3 separate units on 3 other floors. 1 floor is the same as the other case. On the same floor as the other case. So we're now down there to see and carrying out an investigation there. It's underway now. For buildings subject to compulsory testing today, Butterfly Estate, Tip Yi House, there are 2 units. They are neighbors, but they said they didn't know each other. They were on the same floor. A person from each unit. And Toko Wan Maham Road, Cheng Wan building, 2 units. 1 unit has 1 infected case, and the other unit had 2 infected cases. Homeland Teen, Eman House had 2 units infected. They face the same direction, but on different floors. A difference of more than 20 floors between them. So 1 person infected in 1 unit and 4 other people infected in the other unit. In Limouxu, Toushu House, 2 units infected. 1 unit had 1 case, and the other unit had 3 infected cases. Kingswood Villa, Leewood House Court, Block 9, 2 units. 1 unit had 4 cases, the other unit had 1 case. So all these units face the same direction, but had a difference of more than 10 floors in between them. And the Toushu House case, the units face different directions. Tonghei Court, Wahi House, 2 units there. 1 unit had 2 cases, The other unit had one case. They faced the same direction, but had a difference of many floors in between them. Shun On building. Earlier on, there were 2 units with cases, each of which were found to be a source of infection. And today, 2 more units were infected. The previously infected units, the residents did not know each other, but the units face the same direction. The newly found 2 cases, one was on the same floor, the other was on a different floor. Shanghai building mentioned on Peach Street, 1 unit, 1 case. Wan Hing Street, Wan Hing House, 1 unit, 1 case. Shanghai Street 434, 1 unit with 1 case. In Manking House, 1 unit but 2 cases. As for the details about residents who had left the areas, I know the Home Affairs Department will follow up on them. Next question. English question. Lady in white.
Thank you. Good afternoon. A few English questions from RTHK English News. First, about the situation at the Konji shop. Are any of the cases linked to specific cluster? Where does this infection kind of come from? And how high is the risk of the virus spreading to customers who have been there? Second question regarding Tongfa building. Can you tell us a little bit about the units affected? Are they on the same floor or facing the same direction? And because the building is actually quite old, is there a possibility that this might have stemmed from some of the pipe problems, or was it environmental contamination? Thank you very much.
The first case of the Konji shop, I think there's it's an unknown source. Yeah, and I think there are quite a number of restaurants or small shops, food stores affected in the past. But most of them, even they spread in the restaurant or the food stores, the number of workers usually are not big. For this shop, 4 of the affected workers they are from the same family. It's a family shop, and there are also a few other workers. So this may have caused the infection among the workers. So far, we have not identified other cases who claim they visited the shop. So if there are so many colleagues workers affected in the shop, there's bound to be some risk to the visitors of this shop. That's why we asked the general public who have visited the shop to get tested. And for the Dongfa Daiha, I think we'll wait for the site visit result to comment on that. Because there are quite a number of cases in there. So far we have 8 units affected, and 4 units are affected in 2 floors. So they have units in the same floor, and also the numbers. One of the numbers, they have 3 units, and so we need to wait and see the inspection result to comment.
答多條英文問題，南華早報。
Good afternoon. From SCMP. I would like to ask Dr. Chuang, what do you think of the positive rate of 0.3% from the Pitt Street lockdown last night? Do you think this is a measure of very low efficiency? The second question is whether you could, if there are any areas where you think should also or potentially could face a lockdown in the coming days. My third question is regarding the ethnic minority community who have complained that
the government is not doing enough to support them during lockdowns. How do you think the government can better help them and to avoid any sort of discrimination? Thank you.
We found one case, confirmed case last night from the operation. So at least we can prevent the spread of this patient by quarantine the close contact, and also because I understand she live in a subdivided flat, so we also quarantine some other subdivided flats, flatmates. And for the ethnic minorities, I understand in the operation they have, the Home Affairs has employed 18 translators, who can speak multiple languages to help for to explain the lockdown and also the testing arrangements. Yeah, and also the leaflets and also in multiple languages.
下一條
Next question. This one in red at the back. I'm from TVB. Good afternoon. About the congee shop in Hong Kong, are there confirmed cases in that building, residents living upstairs? And about the source of infection in this congee shop, you mentioned that 4 of these cases are actually family members. Can you tell us whether these cases are linked to any possible case? And another question on Eastern District, we see a number of housing estates with confirmed cases. Is it possible that a specified area in the Eastern District should be set up as well? This morning, Dr. Ho Pak Leung said that we should observe whether this is a rebound within the 4th wave or the start of the 5th wave. What do you think, Dr. Zhang? About the 4 cases in the congee shop, they are family members and they work in that congee shop. It's difficult to tell the cause of transmission, perhaps in the shop or in their home. The shop is quite crammed and there might be more physical contact. As for the first case, at the moment is untraceable. So if you check the dashboard, you would find that there are cases all across the territory in various districts, not specifically any districts, but of course there are more cases in Yau Ma Tei and Yau Chim Mong. I'm not sure, but I think that the government will consider various infection control measures. Next question. Good afternoon, I'm from Oriental Daily. First, about Wing Ming Congee Shop in Hong Kong. Although the first case is regarded as untraceable, can you tell us the onset date of the first case? And do you have any idea whether the workers in the shop all wore face masks? And what about the risk of infection of customers visiting the congee shop? And about the 56-year-old patient identified as preliminary positive case, she had shortness of breath in the morning when she was first admitted to hospital, and she passed away quite quickly in the afternoon. And she also had cardiac arrest. Was it because of her underlying illness or because of COVID-19? And her condition deteriorated very rapidly. Is there any assessment on the possible cause? Another question on specific or specified area. Now, in Hong Kong District, there are many shops providing funeral services, and if the area is subject to a lockdown, there could be a grave impact on their business. Would there be advance notice to these business operators? For the first case regarding the congee shop, the onset date was the 18th of January. As for workers in the congee shop, they last went to work on the 23rd and they got tested on the 24th. After all, it's a communicable disease. So if patrons go to the congee shop and meanwhile talk to the workers, there could be a risk of infection, especially during incubation period. It's really difficult to tell the circumstances of each customer at the time. So we just urge everyone who has visited the congee shop to see a doctor if they feel unwell, or get tested as precaution, and we'll further investigate these cases. Well, I'm not the one coordinating the lockdowns, so I don't have information about the 56-year-old patient who passed away in Kwangwa Hospital. On the way to the hospital, this patient did not have a pulse. She had cardiac arrest and she wasn't breathing. The A&E unit administered CPR on the patient. She was also intubated. And then an X-ray of her lungs was taken, and some frosted glasses images were shown. So she was sent to isolation ward for treatment, but her condition deteriorated very rapidly and she ultimately passed away. Because of the short time frame, as mentioned above, her case has been referred to the coroner's court for further inquiry. At the moment, we don't understand the cause of death, whether it's due to her underlying illness or COVID-19, and that is why the case has been referred to the coroner's court for inquiry. Next question. Good afternoon, I'm from AM 730. Among today's confirmed cases, how many of them are from the various specified areas? About the case identified as preliminary positive or confirmed case in Pitt Street restricted area, do you have further information? As for the 4 family members in Wingming congee shop, where do they live? Do they live in the area, and what's the time frame of their cases being confirmed? About 21 untraceable cases. Can you tell us anything about their occupation or any features? Among today's confirmed cases in Yau Chi Mong, there are about 12 cases. In Yau Ma Tei, Mong Kok, in the specified area, there should be about 5 cases. In the Jordan specified area, there are 5 other cases. In Sham Shui Po specified area, no case has been identified, but in Sham Shui Po in general, there are 2 cases. Kowloon City, altogether, 7 cases. In Hong Ham specified area, 1 case. That's all. Your question on untraceable cases? Cases in Tong Fat building account for a number of them. Cases or buildings subject to compulsory testing today, including Tip Yi House. As for their occupation, various occupations, clerical, restaurant workers, retail outlets, students, hairdressing business, property management, retirees, couriers, decoration workers, construction workers, drivers, foreign domestic helpers. In the financial business and housewives.
Sorry, the speaker is not through. Wing Ming Konji shop, the family concerned, they live in Patin Estate. The case discovered last night. The case found last night lives in Pitt Street. Customers at Conchi shop. Well, I know the workers went to the shop last time on the 23rd. And before the 23rd, with those who have been to the Conchi shop the week before 23rd would be concerning. So that is customers going there from the 16th onwards, because the onset of the disease was on January 18th. So people who have been to the Conchi shop from 16th to the 23rd, they should, if needed, go for testing. Sorry, the questioner is not using the mic. There's a case of 44-year-old woman. She had a sore throat on the 27th. Next question. This one, please. Apple Daily. Pitt Street case. What number is it on Pitt Street? What's the patient case number? And also, looking at your entire operation, sealing off 3 buildings and discover 1 positive case. And your notice issued yesterday was on the ground that some sewage sample tested positive. But earlier on in your notices on sewage samples testing, it didn't include Pitt Street 15 to 27A. So was there some sort of error there? Because the 38 to 40 cases on Pitt Street, you categorize the buildings on the basis of their numbers, like 25, 27, odd number flats and so forth. But yesterday, from the Home Affairs Department staff, we learned that those areas were counted as 1 block of building. Was there any miscalculation and you didn't communicate with the Home Affairs Department? Because of the miscalculation, there were some loopholes in your tracing effort, so you didn't really actually easily overlook some cases. That's why you decide to seal off the area. If sewage sample tested positive in those buildings and you only found 1 case of confirmed cases, then does that mean that it failed to achieve your target of finding silent transmitters? And also for 2 days in a row, that is yesterday and the day before in Liu Street, and half of the street had the sewage water sample testing positive. In Kowloon City, from number 1 to 31st, you found that all buildings there had sewage samples testing positive, but you have not yet announced any move to seal off the street. So your decision to seal off an area, is it based on any hard indicators? But still, we've seen that sewage samples for the entire street tested positive. So why no relevant action was taken? My third question is that we received information that maybe Dr. Zhang could help confirm whether it's true or not. Chengyi Container Terminal, it's reported that 3 workers were infected. Rumor has said that the workers there are being arranged to go for testing and leave the workplace. And also, Hoi Wan Hin had 2 cases. Some information says that the hotel security guards and engineering head at the Harbourfront Horizon, about 8 of them altogether were infected, and some were even infected in a quarantine center. Could you confirm whether the information is true or not? As for the sewage samples testing positive, I don't really know much about them. The decision to seal off an area is made by the relevant government department. As for the Pitt Street case, when we issue the compulsory testing notice, we put 15 to 27A as the same building. Just different numbers there, but we've got it as the same building. For today's case, the start is tomorrow case, who's subject to compulsory testing. The case lived on number 27 on the street. Chingyi Container Terminal, number 9 Container Terminal. Yes, there were 3 cases of preliminary positive cases because the workers there undergo testing every week. There are other construction sites with similar cases of workers being infected, but not a large number. But for each construction site, well, if infection occurs, then the workers have to stop for 14 days. All the workers have to be tested, and all the communal facilities or areas where workers eat together, the workers concerned will need to be subject to compulsory quarantine. The Horizon, Harbourfront Horizon place. Harbourfront Horizon, yes, there were security guards there who was infected. Several security guards were infected, and we had, I think, 70 to 80 of the security guards there who shared a changing room or other facilities. Send them to quarantine center. 5 to 6. Yeah, there were cases infected who were found to be infected in quarantine center. Sorry, he's not using the mic. Oh, it's not my decision. Next question, please. Over this side, please. Economic Times. Dr. Lau, the 56-year patient, how was his heart condition like? Did he have any chronic diseases? Where does he live? And I would like to ask about the 14 patients who have undergone Chinese medicine treatment. What is the age distribution? What kinds of Chinese medicine services did they use? 56-year-old case, preliminary positive case. He does have chronic diseases, but for details, I think I'm not in a position to disclose them because of privacy concern. As for where he lives, I don't have the information offhand because the address is unknown according to the emergency clinic, so we don't have the information yet. The 14 patients, as our Chinese medicine team said, these are people with mild symptoms in need of treatment, and they initiated they made the request of getting Chinese medicine treatment. I'm not too familiar with Chinese medicine per se, but the Chinese medicine treatment will help them get over the disease sooner. And I do encourage patients, if they see the need, they can tell our staff and we arrange for them to contact to have a treatment from our Chinese medicine practitioner stationed at the center. And before they seek the Chinese medicine medication, there will be a clinical assessment made by our Western doctor first. If we feel that it's appropriate, we arrange for the Chinese medicine practitioner to issue treatment for them.
I don't have that in hand now. Any more questions? Is this lady at the back? I'm from RTHK. Good afternoon. About the operation last night, some 90 households have yet to be found. Now, what is your assessment of risk? Is it high? Because we're talking about a 4-person household. That means some 400 members of the public are on the loose. Now, do you consider the positive rate of 0.3% as effective? I think in terms of any case identified, we need to follow up on the case with contact tracing and sending the close contacts to quarantine with a view to curbing transmission. The speaker is not coming through. I think we're just doing our best. Any more questions? If not, that's the end of today's press briefing. Thank you.